Liston, Associate Professor of Internal Medicine and Pediatrics.
Hi, my name is Beth Liston. I am a doctor here in Columbus. I've been practicing for the last 10 years. And I strongly believe that we need a healthcare system, not a sick care system. And the Affordable Care Act moves us towards this. Catastrophic insurance that only pays in an emergency, or no insurance at all, relying on emergency rooms to help patients without reimbursement. This focuses on a sick care system. My goal as a doctor, my aspiration is that we as a state, as a nation, focus on keeping people healthy. This saves money, it saves lives, and it allows Ohioans to remain productive and able to work to take care of their families. Health insurance under the ACA is an important step towards this aspiration. As a physician who frequently cares for people who are hospitalized, I see the late complications of disease. I see those patients who come in with a bladder infection, who didn't have access to a doctor, and now they need admission to the hospital because it wasn't treated early. Over 10 million people each year get a bladder infection, and this just requires a simple short course of antibiotics. However, if not addressed early, this can lead to a life-threatening kidney infection and require an expensive hospital stay. The average cost for a single day in a public hospital in Ohio is over $2,000. This is about 10 times the cost what it would take to treat this in a primary care setting. Not to mention the lost productivity for the patient and their family as they have to stay in the hospital. And of course, a kidney infection can be life-threatening, and it's much worse for the person. The Affordable Care Act saves lives. It does this short term through improving access for up to about a million Ohioans. Access which is so important for that bladder infection, which can be treated early, or that cough, which turns out to be lung cancer, but can be caught before it's too late and treated before it's spread. It does this also long term, saving lives long term, by focusing on well care, by providing coverage for things like pap smears, prenatal and maternity care, vaccines, blood pressure screening, blood sugar screening, cholesterol screening, things that we know really make a difference in impact for very little cost. More than 5 million Ohioans benefited from these through the ACA. The ACA also focuses on quality to help decrease preventable errors and avoid occurrences like hospital readmissions. Truly, the impact we are seeing even today from this law, which hasn't been in effect very long, is remarkable, especially considering that those long-term gains that we expect to see from the preventive health measures are going to be occurring over decades. Many patients in Columbus are scared of losing access. I know dozens of physicians that are petrified for their patients who are finally getting on track for managing their healthcare needs. With the ACA in place, I know that when I send a patient home from the hospital, they can and will be seen by an outpatient doctor. They can then continue to help them recover and do what's needed to stay healthy and stay out of the hospital. As a pediatrician, I know of many parents of kids with disabilities who are afraid of how their children will get health care as they grow up if they lose the protections that were enacted by the Affordable Care Act. 1 in 4 Ohioans have a chronic disease that would put coverage at risk. People are scared, and so am I. It is clear that our system is not yet perfect, and reforms are needed. However, it's crucial that we continue moving forward from where we are, improving access, working to decrease costs and improve quality. Repealing the ACA takes our country backwards a decade in our vision of a health care system. We simply can't afford to start from the beginning once again. We have come too far, and this is too important.